Our session really tried to cover what kind of challenges nurses in different parts of the world go through.
We see more and more the evidence that you don't have to give rehabilitation when symptoms occur. You have to start before.
We have to really educate our patients on the importance of monitoring themselves after starting medications, disease-modifying therapies, reporting back important findings or side effects.
I really like that term, prehabilitation. I think that works quite well.
I agree completely.
Yeah.
I loved it when I heard it yesterday.
Hi, my name is Piet Eelen. I'm a clinical nurse specialist working in the National Multiple Sclerosis Centre of Melsbroek in Belgium. I'm a board member of ECTRIMS and I'm a chair of the syllabus committee of EMSP.
Hi, I'm Joelle Massouh and I am an MS clinical nurse specialist and the clinical manager of the Neurology Institute and the MS Centre at Harley Street Medical Centre, Abu Dhabi, UAE. I'm also the ECTRIMS Nursing Program Coordinator and the board member representing the Middle East on the Multiple Sclerosis Nursing International Certification Board.
And I'm Naomi Smith, host of this episode of the ECTRIMS podcast. Nurses and allied health professionals are vital to the treatment, care, and support of people living with multiple sclerosis. Amid a rapidly changing backdrop of research and technological advances, staying up to date on the latest tools and strategies to assist people with MS is paramount to their well-being. This year, at ECTRIMS 2022, 2 sessions were put together to address just that. The first, organized together with the European MS Platform, focused on the evolving role of the nurse regarding MS treatment and research, of which Piet was a speaker. The second was organized together with the MS International Federation and covered the global perspective as to why we urgently need more nurses in MS, of which Joelle was a speaker. So, let's dive in. Piet, you are first. Can you walk us through some of the main highlights of your session on how the role of the nurse in multiple sclerosis has changed over the years?
Yeah, of course. Well, in fact, it's a world that evolves a lot during the last 30 years, and especially, of course, due to coming of the disease-modifying therapies. 30 years ago, we had more like a reactive nursing, where we had more like a total compensating strategy and more focus to pathology and symptom management. And then bit by bit came the DMTs and the role of the nurse starting in supporting and giving advice. But nowadays, the big scala of the DMTs, it's so important to know everything, to guide the person through the start of the medication, know everything what you have to take into account before starting, looking to vaccinations, looking to pregnancy, and also be aware of the monitoring schemes that you have to follow during the therapy. So, especially when there are more DMTs and complex strategy management or protocols, and that together with the shift from burden to risks that we see with the different DMTs, it's so important to monitor the patient on a regular base. And this one is the opportunity for the nurses to follow the patient often, but that together with this is the increase of the care that we have to do, but the decrease of the care is that nowadays we see a lack of nurses in nearly every country in Western Europe. And that's a big challenge, of course. More work from one side and less nurses from the other side. So
Right, okay.
we highlighted this point, of course, yesterday in the morning session of the nurse session. We started with a presentation of Dr. Kraus, where he focused on the evolving role from the neurologist point of view. He pointed out that when we did a review about papers, studies on the role of MS nurses, in fact, they are lacking. We have a few nice references or evidences where we can go to, but it's really lacking, and that was his point also. I wanted to focus on the shift from burden to risks and the support that we have to give, and the expanding our view outside of the DMTs and looking also to rehabilitation I call it sometimes prehabilitation, doing rehabilitation before it's needed, and looking to lifestyle factors. And that together with lifelong support of nurses, because we have to be aware that knowledge is changing so quickly, so we have to learn lifelong, like we have to give a lifelong support to people who are living with a condition that takes for a lifelong. Well, we have to also offer training and education for nurses for a long time.
Absolutely. I really like that term, prehabilitation. I think that works quite well.
I agree completely.
Yeah.
I loved it when I heard it yesterday.
Absolutely. It is. It's a fantastic visual image of what that means and why it's so important.
Yeah, of course, we can elaborate on that, because the lifestyle factors is something that we have to take into account. And nurses, we have to be aware, nurses are really a low threshold. When you go yourself to a doctor, and a doctor is explaining you something, probably you're nodding, and then you go out of the office of the doctor after 15 minutes, and then, okay, what did he say? What I have to do? And you can't remember it, or you do not remember everything. And then, if you have the opportunity to go to the nurse and someone who will take you on your path of the disease, then, well, that is really the added value, of course. And also the added value in adherence and compliance to the therapy. Yeah,
absolutely. And Joelle, narrowing on a rather interesting topic for you, you presented on the unmet need for MS nurses, and you shared a rather unique challenge faced by nurses in the Middle East and North Africa. Can you highlight some of those key points?
Yeah, so our session really tried to cover what kind of challenges nurses in different parts of the world go through. I specifically talked about the challenges nurses in the MENA region face due to cultural differences, due to the original view of the specialist nurse. So patients really go visit doctors specifically. They pick their doctors by name, they go to the doctor specifically, and they don't always understand the importance of the role of the nurse. Okay. Of course, we tried to change that over the last 10 years, more than 10 years, since we established the role of the specialist MS nurse in the Middle East. And that has slowly but very surely changed. Patients now really trust their nurses. Of course, this differs from country to country, and our practices are very different across the Middle East as well, because we come from heterogeneous backgrounds, and we also speak different languages in our medical practice occasionally, and that's also some of the barriers nurses go through to get an education that is really fit for them to become specialized in multiple sclerosis.
Okay. And a number of other presentations were given during the session. Would you like to just sort of briefly highlight a few of the main ones?
Of course, yeah. So my colleagues from Australia really talked about the lived experience of patients and how that shapes the role of the MS nurse. They also shared some interesting data on the role of the MS nurse and the importance of the MS nurse as viewed from the patient's side, and that's from the MS Nurses Report by MS Australia.
There was a variety of topics that were mentioned in both of your sessions, and we're going to try and deep dive into some of those during this episode. And this is a question for you both. You can answer as you like. I want to talk a bit about the current best practices in MS nursing. What are the most important ones that MS nurses need to be aware of? Piet, would you like to go first?
An important task, of course, is managing the disease-modifying therapies, having all knowledge that is needed to inform the patient, to guide the patient, to monitor the side effects, and to prevent the side effects or the complication of side effects. But one thing that is really important is that treatment is not only disease-modifying therapy. Treatment is so much more, and the one thing that hits more and more nowadays is lifelong support, first of all, but then the support that we have to give is like lifestyle support. And we can practically say that there is like a new discipline coming on, and it's lifestyle medicine. So we have to be aware of all aspects of a healthy lifestyle, and of course it's important for everybody, but especially for persons living with the condition with multiple sclerosis. And from the beginning we have to support, engage, and the patient to have a healthy life on different aspects. Not smoking, eating healthy, moving, working on reserves like physical reserves and cognitive reserves. And rehabilitation at a moment is also important. And we see more and more the evidence that you don't have to give a rehabilitation when symptoms occur. You have to start before. And so, yeah, I think that's a main thing, yeah.
Yeah, and you're speaking about, of course, how new disease-modifying therapies have been administered over the past year and how they've changed, and the ones that are in place now, why they're so important. How concretely has this impacted the role of MS nurses today?
Well, I think there is especially a big pitfall. The medication that we start nowadays, well, it gives less burden for the person, in fact, that you have an idea that it's a safe medication. But of course, there are so many side effects that can occur, like liver disease, liver problems, lymphopenia, or starting other autoimmune diseases, all kind of infections, opportunistic infections. And so we have to monitor all these things and be aware that these things can happen. Despite, if you give a medication for the person, it's like there is no problem, there is no burden for the person, in fact.
Okay. Joelle, is there anything that you wanted to add in terms of other best practices that are important to highlight?
Yeah, just to emphasize what Piet was also saying, that the shift of the burden from the treatment burden to risks is very important. We have to really educate our patients on the importance of monitoring themselves after starting medications, disease-modifying therapies, reporting back important findings or side effects. And also we have to help them stick to some monitoring regimens with certain drugs that can be a bit exhaustive for them. Other best practices include symptom management as well. The role of the nurse in symptom management is very important. The emphasis on that, really trying to normalize to our patients that they will be having some symptoms such as fatigue, which is so very common in MS, normalizing mental health, and the issue of depression and anxiety and other mental health problems our patients might face, which can be very common.
Right. One of the reasons why it's, of course, so important for nurses to be part of ECTRIMS 2022 is because they are vital, of course, to the treatment, care, and support of people living with MS. In terms of contributing to research, can you talk a bit about this important aspect as well, especially in terms of providing nursing evidence in clinical practice?
So definitely nurses have been known to really ask the important questions in research. They bring those questions from their clinical practice, from their daily lives, from their holistic view of patient care. So it's not a question of whether nurses have the right research questions. They probably do. It's the opportunity of doing valuable research and contributing to research, the opportunity of being supported by their institutions, and the fact that they also need funding, and that's not always easy to get or procure. So part of what the sessions covered yesterday was really helping nurses in figuring out how to approach that and asking the right questions and contributing to research. And if they have any doubts or issues, to really go through training programs such as I would believe Piet will be talking about the program that will be launched, the research module. So nurses really need to be educated on that, and they will be able to deliver research. Coming to congresses, large congresses such as ECTRIMS and similar congresses really helps nurses come up with research questions and get inspired as well, and network and participate with other MS specialists.
Right. Piet, is there anything you want to add to that?
Yeah, I think it's an important step in professionalization of the nurse. Normally we help doctors doing their work and we take care of the patient, but we have to take care of our profession also. And doing some research on ourselves can add to the economic value of the nurses to look for that, or to the added value that nurses in general can offer in the support that we all give together nurses, doctors, and the rehabilitation team to the patient. I think it's pivotal, and it's sometimes a little bit out of our comfort zone doing research, and so it's really important that, like Joelle said, that there is a recognition of the institution where you're working in to be a research nurse, and also recognition by the government or the country where you're working in. And we see quite differences, of course, in the European countries, but also between America and Europe. Yeah.
I think it's so important as well when you're tackling a disease such as multiple sclerosis to make sure that it is that we are connected on so many different fronts in terms of providing support and sharing knowledge.
Yeah.
And so for MS nurses to be connected to the MS research community, I think it's just it's a vital connection that needs to happen in order to enhance research opportunities in the future, to enhance training opportunities. That everything does need to come together at some point.
Yeah.
And on that note, Piet, EMSP offers a very specific program for MS nurses. It's called MS Nurse Pro. It's funded by ECTRIMS. Can you tell us a bit about the value that this program provides for the professional development of MS nurses and how they become part of it, how they can join it?
Yeah, it's an online e-learning training in different modules. We started with a foundation course with 5 modules. Characteristics of multiple sclerosis, symptoms of multiple sclerosis, diagnosis and treatment were discussed. And bit by bit we elaborated with a 6th module on rehabilitation. And now we launched during ECTRIMS this year the 7th module on research. The advances of MS Nurse Pro is that you can first do it in your own mother tongue. It's available in different languages, in 13 languages across Europe for the moment. Not all modules are in all languages. So it's really easy for nurses to step into it. You can do it at your own pace. You can do it module by module. It takes, of course, different hours, and especially you can come back to the modules when you need some information and look for the things that you need. And then especially now the research module is to motivate, enhance and advocate for the nurses doing research and all the information that you need to start with research and the added value of nursing research. Besides the modules, we have the community of MS Nurse Pro, which is quite important because we make links between nurses and we can support one another over the different countries and establishing really a community of MS nurses in Europe.
Okay. How long has the program been in place?
10, 12 years, I think.
10, 12 years, okay. And how have you seen it evolve during that time? What did it look like at the beginning? Were the languages added later? And how many people are engaged in the program now?
Yeah, of course, like everything, I think it started up quite slowly. The biggest change came a few years ago when we used another platform and it was really reshaped and remodeled, and it's really attractive tool that you can use now. For the moment, we have like 8,000-9,000 users already on the platform. It's different, of course, because you have every module, you have a certification, an exam that you can do, and then you get the certification per module, and finally you get a certification of the complete MS Nurse Pro. And we see that lots of people do some modules where they're interested in probably, and then take up a little bit later. So it's really an thing that is living between the community, I think. Yeah.
And on the issue of certification then, for MS nurses, in addition to the program that you're offering, I want to talk a bit about what the current landscape is like for certification for MS nurses. What does it look like, and are there any challenges that require improvement at the time, and especially in terms of looking at skills and knowledge support? Joelle, did you want to take this one?
Yeah, sure. As part of the Multiple Sclerosis Nursing International Certification Board, what we do is really we set the criteria for the certification by the International Organization of MS Nurses. So this is an exam that can be available for nurses to take twice a year. Preparation for that exam is really on the nurse herself, but we offer resources that are available online. From our experience in the Middle East, we felt that certification really provides nurses with important credentials that they can use in their community, in their hospital, to feel more confident about the roles they are playing. It definitely gives a weight even for patients when we are talking to patients and we explain what we are, that I am an MS certified nurse. They do feel there's an increased confidence in dealing with us, in getting their questions answered, and getting the right evidence and science behind their symptoms, behind their disease process, those explanations. Definitely, we promote specialization and certification, and we believe in the value of that. So we've been trying to increase our numbers in the region for certified nurses. There's definitely barriers and challenges. We discussed a lot of that in our session yesterday. And those, of course, include the issues of language, cultural, how culturally appropriate some questions are. And this is what we do when we are revising the exam every year. We have nurses from all over the world, from Europe, from Australia, the Middle East, North America. And we try to make questions that are culturally appropriate to everyone, and we remove those questions that are not. So it's an effort we're working on every year as well.
Yeah. Yeah, it's quite a task to be able to separate the cultural questions. I can see how that would take quite some time to make sure that it's appropriate for all. Absolutely, and the language barriers as well.
Yeah, and some questions and some scenarios, they're really only applicable to certain countries or to specifically North America. So we try to really make that exam cross borders as much as we can.
Can you give an example of something that you'd have to remove from one side to the other?
Yeah, things like specific like long-term facilities, let's say, that are available in the US and not available in other countries, and how patients get referred to that, the role of nurses in referring to those areas, specifically like the role of some also medications or drugs that are not available in all parts of the world. So we have to be a bit more attuned to that as well.
And Piet, did you want to
add? Financial support is probably also different from country to country.
Yeah, exactly.
Yeah. Well, of course, MS Nurse Pro is really focusing on the European situation, and we do not have the differences in questions in the different countries. Maybe it's quite important also to say that we have an accreditation of our modules and the exam and the certification by the International Organization of MS Nurses, also by the Royal College of Nursing from the UK, and several other associations, and also acknowledgements by nearly all MS societies of Europe and organization of neurologists or MS specialists. I think it's interesting that the platform can be used by nurses at different points. We do not have that. I think the education and the training that we give by MS Nurse Pro is really an advantage, and it's something different from the IOMSN situation. There is really focusing on the certification, and here the certification in Europe, of course, is different from country to country. But also the European MS platform is an advocate in helping the different countries to come to an accreditation. So here we have the accreditation that is given by the UK, by Germany, and it's different from country to country.
Right. So before we wrap up, are there any other key bits that you'd like to kind of focus on in today's episode to highlight in terms of MS nurses and the role they play in the community?
Yes, sure. I actually really wanted to talk about an important issue we mentioned yesterday in the sessions as well, and that is the increasing prevalence of MS. We touched on what theories might be behind the increasing prevalence, be it from improved diagnosis or an actual true increase in prevalence. And this is also coupled with a very important issue, which is the shortage of MS nurses. We're facing nurses in general, but specifically also MS nurses. Even in our region, we lost a few nurses to, and we have very few certified nurses, so that made a real difference. Some nurses immigrated or left the profession because of various reasons, including economic crisis, the pandemic, so many changes that nurses and the rest of the world went through in the last few years. So yes, there should be strategies for us to be able to try to work and improve on retaining nurses and on adding value and fulfillment to their everyday lives and careers.
Yeah, I totally agree with you, Joelle. And I think that, as you said, we see more MS, but also the assessment and the diagnosis tools are better. And we see so not only more, but quicker MS. And so the caseload for the nurses and the doctors of patients with MS is becoming bigger and bigger. And that, together with the decrease of nurses, like you mentioned also due to several reasons, but especially also COVID and the decrease in nurses, that would be a big challenge. And I think that with research and focusing on research, nursing research, and focusing on accreditations and programs like MS Nurse Pro and the certification of IOMSN can help nurses building a career with the nice tools and recognition and professionalization. I think that is really a thing where we have to look for, and it can be a nice opportunity for nurses to join our MS Nurse community.
I agree completely. We have to all rally behind each other and really support each other in these difficult times.
Yeah, absolutely.
Yeah.
Absolutely. Wonderful. Thank you, Piet and Joelle, and thank you all for listening. Stay tuned for more episodes of the ECTRIMS podcast in the coming weeks as we continue to dissect key information from this year's Congress. In support of MS nurses, physiotherapists, occupational therapists, and related allied healthcare professionals, ECTRIMS offers a professional fellowship training program. Applications for the 2023 cycle are currently being accepted. Visit ectrims.eu to learn more about this program. You can subscribe to the ECTRIMS podcast on all your favorite podcast channels, including Apple and Spotify, and be sure to follow us on Twitter, LinkedIn, Facebook, and YouTube.